Hey, hello and welcome back to another Let's Talk It Out. This is Car Support Services, and I am Ray Castillo, CEO, President, and Founder. Did I say that already? Yeah, I did. Whatever. PSS. This is
I'm Xavier, Director of Operations, and we're sorry about the trailer. We didn't know it was a mute trailer,
I guess.
but
I just noticed that too. I was like, nobody's talking on the trailer.
I hope it intrigued you to watch the movie. It was really good.
Absolutely, and I'd like to really welcome and present not only a colleague but a dear friend of mine who is a big ally of the LGBTQ plus community, also a recent graduate of Pfeiffer Marriage and Family Therapy Program. So she is an official marriage and family therapist and also an administrator for the MFT for Systemic Change. And I'm going to let her introduce herself a little bit and talk a little bit about her, and then also about what she's trying to do with the MFT Systemic Change. Go ahead, Shacoya. Welcome.
Hey, thank you. Thank you so much for inviting me. Yes, I am actually I am an ally, and I struggle with that word, but I love everyone, so I'm an ally to everyone, I would say. So, like Ray said, I'm a recent graduate of the Marriage and Family Therapy Program, and I run the Facebook group Systemic MFTs for Systemic Change. And in that group, we're just working on how to change things at a higher level, just more social justice for systemic therapists. So anybody that's down for changing things and not liking how society is ran right now, we are ready to change it, and that's what we do on that group. So thank you
Absolutely.
guys for inviting me.
Oh yeah, thank you for being with us. It's awesome to have you here today.
Thank you so much, Shakoya, and it's great to hear that we as therapists can use our education in the correct forums to be able to effect change in our society. Most of us, people usually see us as shrinks, and people are accustomed to seeing us, in an office behind a desk,
Mm-hmm.
and we can do so much more than just that with our
Yes.
knowledge and our power in society to change.
Yeah, and I
Mm-hmm.
want to, take this moment to let anybody that's watching us or will watch us at a later time, any therapist that is out there that would like to join, the MFT for Systemic Change group, please do so. It's very informative. It's very open, and what Sequoia's vision is in doing this, and I know that because we talked about it prior to her starting it, is to bring change, to bring a different perspective on what is happening today. So,
Mm-hmm.
with that said, let's go ahead and talk a little bit about today's topic, which is a topic that is really, really important, and especially within the LGBT community.
So we're talking about depression and anxiety today. And we just want to open, the discussion to not only what is the diagnosis of depression and anxiety, what it looks like, but we also want to kind of give or enlighten people about learning how to identify symptoms and really getting down on sadness and crying does not necessarily equal depression,
Right.
and that we have to be very, very careful as to when we um, throw words out there, the labels we put on people, and the impact that has on them and their mental health. So, as you guys saw at the beginning of our live session, we saw the movie A Single Man. And for those of you who got to see the movie is about a professor. What was his name? I forgot his name. His name was
George Falcon.
George Faulkner, who is a college professor who loses his partner and goes into a deep depression
Yes.
because of it, contemplating suicide at one moment, and how he kind of finds other people around him right when he's on the verge of actually going through with his suicidal plan that kind of help him get out of that, and that includes friends and just strangers, because really
It
that
was,
it
yeah.
was a
Well, it was
total
a student
stranger.
of his, right? That can help him. But I wanna speak to the movie, right? But I want to speak to the movie because one of the things that I like about the movie, first of all, is that this movie was released in 2013, if I'm not mistaken, 2010, 2013. But it depicts a scenario back in the 60s, I guess it was 62, and where for the LGBT community, right, we were still kind of like closeted. It was
Mm-hmm.
still not something that was socially acceptable. It was something that was really difficult. As a matter of fact, I love the fact that in one of the scenes when they call him, in one of the beginning scenes when they call him to tell him that his partner had passed away, they told him, no, the funeral is only for family. And that, more than just family, in other words, was, we don't want you here because we don't want you as a former lover, whatever they wanted to call it, right? And that time, right? And also, what I love about also the movie is how they use the persona of a professor, right? That I think
Mm-hmm.
that's important. I think it's important to kind of bring about the whole situation of depression or anxiety can hit anybody at any given time.
Mm-hmm.
It's not someone that it's a homeless person or only a person going through whatever situation may be. No, it's anyone. So what do you think?
In the beginning of the movie, he talked about fear, and he talked about George. He talked about what a minority was, and I think, even in that part, he was saying, that's us. We're all minorities, but that's the fear part that's speaking to everyone else. But he was saying, I'm just like everyone else, and I think that when we're talking about depression, anxiety, it can hit anyone. And he was someone that seemed successful in his life. The younger guy, he was like, this is the life that we want to have. And so people have this persona that, oh, they're perfect. They have the life that they want, but we don't know what others are struggling with. We
That's
didn't know.
right.
So, and he was, like you said, Ray, a professor. He was successful. He was someone that you wouldn't expect to be depressed or have any type of mental illness at all.
Correct.
So labels
And
are bad.
yeah, and I want to highlight that, right? Because for us, right, therapists, we know that this is very common and this is very prevalent in our community, in our society, right? Um, we see, I think that for us, right, we are at a point where and most of our clients that have lately at least come in since I've been an intern have been suffering from depression or anxiety. It's very prevalent, very common, right? So we are used to, as therapists, to see anyone walking to our office or our clinic, and whether it's a common worker or a professional worker, right, that is suffering from these symptoms. So and then to top it off, different age groups,
Mm-hmm.
different people from different walks of life, right? But that's us as therapists in the room, right? And knowing this. When it comes to community, a lot of people have misconceptions of what depression is and who does depression hit or anxiety,
Mm-hmm.
right?
Yeah.
So let's go ahead and dig in a little bit more. I think that there was a couple of things that I liked particularly about the movie, and my question to Xavier and you, Shacoya, is what did you guys think about the general context of the movie in relation to depression and anxiety?
Hmm. You gonna go first, Xavier?
And I'm sorry, guys, we're kind of moving the computer because we're having some technical difficulties, but
With the
with
microphone.
the microphone. But so yeah, I think I think the movie did a good job in depicting uh, depression very, very well. In many ways, I think everything from his affect to, like I said, contemplating suicide, the flashbacks, the lack of him kind of wanting to engage with other people. And that's kind of what you typically see when you have a person that is suffering from depression, is you see that kind of isolation from everyone else. They don't want to kind of really be involved. Now, he kind of found it in himself to actually get up and continue with some aspects of his life. But I think at the same time, part of what kept him going in those moments was the fact that he felt as though having already a plan to end his life, he knew he was going to get a sense of relief at that moment. So he was just putting everything he needed into place to then go ahead and go for it. And we as therapists see that more often than not. People kind of have this phase where they don't want to get up, they don't want to engage, they isolate themselves. But then when they're really contemplating suicide, or they have suicidal thoughts, you can see that shift. And for people who are not trained, it might be difficult. But I think for us as therapists, you can see that immediate change where they come into therapy one day and they're really, really, energetic and sad and depressed. And then all of a sudden they come one day into therapy and they're like, I'm going to discharge myself. I feel completely fine. I'm great. Thank you so much for your service. And that's where your light bulb goes off. And it's like, wait, what's happening here? It's like something changed. Was it for the better or was it for the worst? So I think the movie did a really good job in giving those subtle kind of bits and pieces that to me, and I think were very obvious that he was in a depression. He was drinking a lot, which is something that we also see, especially alcohol, because he was suffering for what looked like panic attacks. So it's things that you can actually, and I think I might even consider at some point some PTSD with the flashbacks that he was having about his partner in the accident. That first scene that opens the movie when he's kissing him, kissing his dead body, is kind of like, wow. It's very, very difficult to kind of digest.
Yeah, I like that you said about the suicidal part, because that shift, that change, and even his maid, she seen it immediately. She said, what's going on?" But we think that people are getting better, and like regular people, we see these sadness, and then we're like, snap out of it. We're telling them usually, get out of there, get up and do something. And he said, today's going to be different. So he did looked like he snapped out of it, but he was still, he was contemplating being with his partner again, because that's what ending it was going to be for him. And if we're not paying attention to these subtle things that can happen, these changes, these being energized, giving away, finding new jewelry, him speaking to his friend, and she herself was, what was her friend, Charlie, I think.
Charlie.
Yeah, she was depressed herself, and she noticed it, I think. So noticing these things are important, and then just being able, as some advice I would give, is calling it out. And it seemed like that's what the young guy did. He may have hit the gun and held it for him, but calling these things out. You seem sad. You seem different. What's changed? Are you going to hurt yourself? And not being afraid to say those words. Since we're talking about this, I think it's very important to say that.
Absolutely. I think I agree to that, Shacoya. And also, I always tell people, right, and this is again from the perspective of therapists, we are trained, not to take anything lightly, right? We gotta take what our clients tell us serious, right? And then we're trained to kind of dig in and to see what's going on in their heads. But for anyone out there, at any given moment, if anybody tells you they're contemplating suicide, they're thinking about ending their life, or they're thinking about hurting themselves or hurting someone else, I would ask to please take that very serious. Don't
Yeah.
take it lightly, because if I'm not mistaken, and I used to know 100% the statistics, but usually a person that is contemplating suicide will notify of their an intention of wanting to end their lives a few times before they actually, or with intent, or sometimes without intent, a few times before they actually do that.
Mm-hmm. Yeah, absolutely right.
Yes, Don. We're gonna get to that right now. Let's go into what I like for us to do is let's go ahead and discuss a little bit about what depression is, right? This is more, we always want to educate
Yeah.
our viewers, and so let's talk a little bit about what depression is, and how many people are actually affected by depression, and then we'll talk a little bit about anxiety, and then we'll go into what it looks like for the LGBT.
So, depression affects. Let me move the computer so you guys can hear me better. So, depression is currently affecting around 322 million people, according to the Anxiety and Depression Association of America, and around 15.6 million adults over the age of 18 in the U.S. have had experienced at least one major depressive episode in the last year. So
Mm-hmm.
this is a very significant number. And I also want to clarify, I think I want to stop right here and clarify, like I said at the beginning, it's very important to not take it lightly, right? But at the same time, also understand that we can have mild episodes of depression that are not necessarily long lasting, but that can be triggered by certain events in our life.
Mm-hmm.
Losing a family member, moving into a new town or into a new place, breakups, financial
Death.
problems, deaths. These things, the coronavirus, these are things that definitely play a huge role in our mood. And the fact that we feel sad and the fact that we cry doesn't not necessarily mean that we have depression
Mm-hmm.
or clinical depression or chronic depression. We can feel depressed, and I think that is completely valid for every single human being because that's part of our emotional process. But now, if it lasts for more than 6 months and it becomes chronic, and then it turns into isolation and not wanting to get out of bed and having a total lack of energy and other symptoms come along, then that can be considered a chronic depression. But we are entitled, my people, my loves, we are entitled to feel sad. We are
Mm-hmm.
entitled to feel depressed. And it's okay to have those feelings. We are human beings. And what separates us from other animals is the capacity that we have to emote, to feel
Yeah.
emotion. So it's very important that we kind of let those people in our lives that we are seeing on a day to day that are struggling with sadness to kind of let them give them that space to be sad, but at the same time check in and say, hey, are you okay? Is there something I can do to help you? Hey, I think you've been in this kind of a slump for a little bit. Why don't we go and talk to someone about it? Why don't we go and kind of help you get help? Why don't we go and kind of find someone who you can vent, and we can kind of see if this probably is a lot more serious than you and I probably think. There's absolutely no problem in actually saying that. So again, depression, we all go through it at some point or another. We just have to be very cautious of at what point it becomes something chronic. Shakoya, anything to add?
Yeah, I was just thinking about, the words that people say to others. Sometimes we're saying those jump out there. You don't have anything to be depressed about. Your life is great. You should be happy. Sometimes it's also a chemical imbalance that's going on with us. It could be seasonal. There could be a lot of other reasons for having depression. So making sure that you're mindful of that and you're not pushing your loved one farther away or deeper into that depression by not really thinking that you're helping, but not actually helping. So make sure that the words that you use, you're being very mindful of what's coming out of your mouth. Sometimes they just can't snap out of it, because I'm sure if they could, they would. So just be mindful of that.
Yeah, and I want to briefly kind of, without going into much detail, because I'm kind of, I get a little passionate sometimes, but um so what I always explain to my clients who suffer from depression, and I kind of want to explain to everyone who's watching and who will watch this later. So when we're born, as our brain is developing in the fetus, in the fetus and in the womb, um, we have specialized cells that compose our brain, and they're called neurons. And different from red blood cells and white blood cells, who travel all throughout our body and have a life expectancy and then die, the neurons that we're born with are the neurons that we're going to have for the rest of our lives. And they are static, they don't move, they're in our brain and they don't travel anywhere else, they just sit there. And they communicate two ways. They communicate by electrical impulses, and they communicate through liberation of different chemicals. So an electrical impulse tells that neuron to release a certain chemical, and that chemical lets our body know that we're feeling some kind of way. And in the case of depression, there's a chemical called serotonin, which is responsible for making us feel happy, for making us feel good. And there is such a thing as some people who don't produce, their brains do not produce enough serotonin. Hence, because they don't produce enough serotonin, their brain is not capable of recognizing that they're happy. So it doesn't matter how much cake and ice cream you buy them. It doesn't matter how many times you take them to Disney World. It doesn't matter how much you try to do for them. They cannot feel it, because the chemicals in their brain that are supposed to be telling their bodies to feel happy are not there. That's where medication comes in. The medication that is prescribed to treat depression, what it does is it helps the brain accumulate enough of that serotonin to be able to let the brain, and the brain let the body know that we're okay, that we're happy, that we're stable. And people tend to start feeling a lot better when that chemical imbalance is fixed through the use of antidepressants or anti-anxiety medication. Anyways, that was my spiel.
Thank you.
No.
Thank you very much for that medical perspective. As a nurse, a graduate nurse, and then went on to be a therapist, he has to bring that scientific part to it. No, and I'm
Yeah.
glad you actually brought that point, Xavier, because let's talk a little bit about, the stigma behind medication.
Mm.
Shacoya,
Mm.
what's your thought on that one?
You know, I think that I have mixed feelings about it. I don't think it's just about the stigma behind the medication. I think it's more about the labels that people place on these, on others because they're taking medication. Let's take it out of mental health. Right? I think COVID right now has a stigma put on it. We see someone coughing. I'm sorry. I've been around people, and if someone coughs, we're like, "Oh, they got the COVID." So now that's a bad thing, right? If you have COVID, you're bad. You did something wrong, and that is the exact same thing with mental illness, and it's not true. It's something that is, yes, it could be a chemical imbalance. It's something that we all go through, especially with feeling down and feeling low. It's not anything to say that um, you're not a good human being, because you are. It's just that in this moment, you may be having feeling down for whatever reason, if it's a chemical imbalance or some sadness or something that happened in your life. So that's my biggest thing, is the label behind the actual mental illness. Now, if someone decides that they want to take medication and that is what works for them, I'm happy. If they want to do talk therapy, I'm happy. If whatever is working for them, I like a combination usually works the best, but I'm very client centered, what they feel is best.
Absolutely, I agree with you on that because and that's what I don't when my clients are asking me, what do you think? Do you think I should go for medication? I say I don't say yes and I don't say no. I say I don't know, what's best for you. I know what I can do to make you feel better and get you going, and But then again, I believe that there is a reason why medication is there and available. And I say I'm not a prescriber, I'm not a medical doctor, so I always love to work with a doctor, a psychiatrist,
Mm-hmm.
better than anything else, that can work along with us, because I believe that when the person is under medication when they need it, right, and it's needed, and therapy together, that's the best way to go about that.
Yeah.
So let's go ahead and jump into anxiety and what anxiety is, right? Because um, everybody says, "Oh, I'm anxious. I feel anxious, or I have anxiety. Oh my God, But anxiety is just like depression. It can come in many different ways, and sometimes people don't even know that they are suffering from an anxiety disorder. One thing is like, I'm a bit anxious about a test. I'm a bit
Mm-hmm.
anxious about my meeting my first date, versus suffering from a panic disorder, panic attack, and all these other anxiety disorders. So, what's your take on that, Sequoia, with anxiety?
Yeah, I think that exactly what you're saying. A lot of people have it, and of course, we know that depression and anxiety come hand in hand. So we know that. So it just makes sense if you're depressed and worried about things, and then it's going to create some anxiety within inside of you. So knowing that those two come together is very important to know. So I think we struggle all with some anxiety, but when is it a clinical diagnosis? That's when you need to make sure that you're paying attention to that.
Yes, and it's also one of the most common mental health illnesses. And then let's talk about the COVID-19, right? You just said you go somewhere, someone coughs, everybody immediately goes into a panic mode. That's anxiety. Everybody is living right now with anxiety because you don't know. We're dealing with something that we don't know, and therefore it makes us uncomfortable. It makes us nervous. It makes us be on a flight or fight type of a
Mm-hmm.
guard. Like don't talk to me. Where's your mask? So it's more common these days than it is that it was or wasn't seen at one point or another.
I like to say that anxiety is living in the future, right? So you're worried about what's going on in the future. Depression is like you're living in the past. You're feeling sorrowful about what happened in the past. And if you're just staying in the here and now, which is called a present, and staying present right now, that's how you kind of know that you're doing okay instead of trying to go too far in the future or far in the past. So staying in the present is very helpful.
Absolutely.
So here I go again. Um, I kind of always explain anxiety. Anxiety is a very primitive feeling, and it's very essential to our survival. Anxiety is that one feeling that helps us, like Ray mentioned, we fly or we fight. And because it's such a primitive feeling, I always like to say it's that little caveman in your head that is solely responsible for looking at things in your environment that he or she or they could perceive as dangerous or as something threatening. And its only job is to press the panic button. For some people who don't suffer from anxiety or who don't have anxiety, that little caveman does its job. Whenever we're going to cross the street and a car is about to hit us, he pushes that panic button and we move out of the way. Now, for other people, that little caveman has a little bit of
Adrenaline.
adrenaline and has a little bit of an issue, and it might perceive things from the environment that are normally or are not to other people threatening, and it might perceive it as something threatening, and it just pushes that panic button constantly. Anxiety is one of those disorders that drains people. One
Mhm.
of the commonalities of anxiety is the constant drain. Because when you are constantly in panic mode,
Mhm.
you produce adrenaline. Adrenaline is responsible for pumping up your heart rate, contracting your muscles, and people actually get physically ill from anxiety because that adrenaline is constantly pumping through their body. Their heart rate is constantly up, their blood pressure goes up, their muscles get tense. So that's when you get muscle tightness, you get muscle spasms, you get high blood pressure, and then that in itself can produce other physical ailments. Sorry, that was really good.
No, that's perfectly fine. We're educating, right? And part of it is, and it's very common. You were touching up on it, Shagoya, that it's very common that these two work hand in hand, right? So it's very common to see someone coming in from depression that suffers also from an anxiety disorder, or vice versa, right? Coming in because they're very anxious, but then as you dig in, then also you find depression there. So they're very buddies, and they usually hang together. So usually when we're treating a client, we usually look for symptoms of anxiety, but we also are looking for depression as well. And then we're treating both, right? To try to help the client move forward to that. What has been your experience in dealing with that, Shikoya?
Yes, but most like you guys said, most people don't realize that that's what they have. They don't realize that they are experiencing anxiety, and I think that in itself is scary, right? When we don't know what's going on and living at that heightened, just always on alert it takes a toll on you emotionally and on your body, like Xavier was saying.
Mhm.
So we have to take care of ourselves. We have to talk to someone. We have to figure out what to do. It's Don't let that anxiety stop you. Don't let that depression stop you. Ask for help. There are people that would are sitting there waiting to help you. So finding that. And when you're talking about George, the from the movie, suffering from PTSD, I just remembered he said that he was scared to get in a car. I don't know if you guys, it just came in my head when you said that. He said he was scared and worried about getting in a car. And, that could be that from that anxiety from his partner being killed in a car accident. So we never know, like we said, we never know what people are dealing with.
Absolutely. So now let's get into the whole, while we're here, right? Let's talk depression and anxiety in our community, in the LGBT community, right? And we don't have clear, and Dawn was asking us earlier, do we have any data on anxiety and depression in the LGBTQIA community versus the straight community? Unfortunately, no, we do not have enough data to give us an exact number. We do have percentages within the LGBTQ AI plus community when it comes to depression and anxiety. And what we do have is that between 30 to 60%, and now we're talking about 30 to 60% in the lesbian, gay men, and bisexuals or transgender people who deal with anxiety and depression at some point in their lives. So when we look at that percentage, right, to the number, it's pretty alarming. It's big.
That's
And oh, sorry. It also says that the rate is 1.5 or 1.5 to 2.5 times higher than straight people. So people in the LGBTQAI plus community are twice as likely to suffer from depression and anxiety than our straight allies. So and I think when you really break it down and think about it, the stigma, the social stigma that comes behind being openly gay or openly lesbian or openly transgender or openly bisexual plays a huge role in the way that we see ourselves feel. It plays a huge role in our self-image. It plays a role in our fear, in the fear that we have of going out in public, in what people are going to think about us, in what people are going to say about us, what our family members are going to think, how accepting our family members are going to be. And we have to, a wonderful family therapist on the screen, and one fabulous to be family therapist here. So I think you guys can kind of talk about, the family impact of of working with, an LGBT person in the family system.
Yeah. I want to say something because this is when I was watching the movie. The biggest thing that I looked at and thought about was the disenfranchised grief that he was experiencing because he could not openly mourn his partner. He was not, if he was his wife, then people would have, they would have immediately called him. They would have immediately reached out and take care of him. He was even unable to go to the funeral. He was unable to say formal goodbyes. So this, I think, causes a lot of depression on people, feeling isolated, feeling by yourself. You're not able to mourn outwardly. I don't even, it makes me upset because I know that there's a lot of people that experience that disenfranchised grief that they cannot say, hey, my partner died. I'm sad. I need someone, someone to come and just take care of them like we would do with anybody else. He not having that ability because the family is not okay with it, or they're not seeing like his friend. She didn't even call it. What did she call it? She said that wasn't a real relationship. Mm-hmm. And I was like, wow. I mean, he got upset, but then he still was, that's his friend, but that wasn't a real relationship.
So, and yeah, and thank you for bringing that point up because again, although this movie is based on 1962, and we can say that we're more open, we're more accepted, perhaps we are more okay with gay relationships, and being part of the queer community. However, there are still so many different levels and other things that affect us on a daily basis. Trying to be yourself, whether it's at your work setting, with around your family who do not support you, right? Your neighbors, right? So all of these things are things that the queer community has to deal with, right? That causes a lot of anxiety and depression when you're trying to simply be who you are, but you're not even accepted. I'm going to go a little bit deeper because we love to go deeper. Even within the queer community, right? What about, when we look at the transgender community versus the lesbian, gay, or bisexual community? Talk about the prejudice, the discrimination, the constant, shaming, the constant ridiculing, that are things that are very vivid within our own community.
Mm-hmm. I have a question. Oh, sorry.
No, go ahead.
I have a question for you guys as an ally, if you don't mind. Because I think and I worry that people say, oh, they're depressed because they're gay. He was depressed because he's gay. I don't agree with that, but I would want to hear from you guys and how you guys, because if the rates are higher, I can see where people would say that. So I just want to hear from you guys as we get deep. Do you feel like that's true? Can we debunk that right now and say that everybody gets like this, or what is your opinion?
So I just want to say, no, it's not. We're not depressed because we're gay. We are depressed most of the time. When we are depressed because we live in a society that thinks of us as weird, as less than, that treat us differently, that don't think that we're capable, that treat us like we are child molesters, that treat us like we're not capable of doing what normal people do, that we're
That we're
going
not
to
considered.
that we're not a regular family, that we are going to hell, that God doesn't love us. And if you take that and extrapolate it and put it into a straight person, it would be the same if you tell a child or an adolescent or even an adult, a straight adult, and you tell them every day that they're worthless, that they're useless, that they're not worth anything, that they are stupid, that they're dumb, that it wears it makes a big hole in your self-esteem. Then you start to believe it, you start to believe that you are worthless, you start to believe that you are not worthy of living, you start to think that you're not worthy of having love, of being loved, and then your family pushes you away, and you lose that sense of self, you lose that sense of who you are and where you belong. And that's what causes the depression. Gayness does not cause depression. It's what society, it is the burden that society puts on us as queer people that leads to depression and to
Mhm.
anxiety.
So I want to add to what Xavier is saying, because it really segues into the minority stressors, right? And what how we as a minority category within our society can can empathize with the Black Lives Movement, with the other the feminist movements, and everything else, because we are all simply trying to be recognized, respected, affirmed on who we are as people, as persons, not less than. We're the same, right? But when people tell us, "Oh yeah, well you still get rights and you're still okay, you still get treated equally," but then your actions against us, when we have a simple bright little flag up in our on our front yard, or
Mhm.
when we're scared to even give my husband to be soon next week a kiss before, I'll cry before we go to work, or anything like that, and you're living in that constant fear of what my neighbor's gonna say or do to me if they see me doing a simple love act for one another. How can we not live in such an anxious state and a depressive state, right? So going into the minority category, you know, the minority stressors that are associated with being a member of the LGBT plus community, right? The discrimination that comes in so many different forms. And, it's funny because studies have shown that this is such a powerful and lasting, that this stress that the LGBT community carry is such a powerful and lasting negative impact on the mental health and the well-being of the LGBT people for life.
Mhm.
So this is something that it's big, and and this is why we are lifting this up, because we need to let everybody know. What do you think, Shakoya?
Right now, even, I mean, of course before, but even more heightened right now. I think we're not looking at that. Even talking about medical rights, like, right? So what if if you're trying to see your partner and they're like, no, you can't, you're not, you're not actually their partner or their spouse. That's a huge thing, if the, and I get passionate about it too, because I just feel like it's just not fair. You love whoever you love, and that's not for anybody to say that you can't, and it's not for anybody to say that you have to be treated differently.
Mhm.
Yes, absolutely. That makes absolute sense. I don't understand why anybody could see anything different than the fact that, yeah, you do have more stressors. These stressors are combined and not. I think about, what if I was scared to kiss my husband when I seen him? What? Like, you should be able to, like, you're not like out there doing anything. I know Ray, so I know that he's so. But why? It's not harming anyone. So yes, this is. I can see why it would cause anxiety that you cannot hold your partner's hand. You can't be who you are. I think what I didn't hear you say, the biggest thing for me is acceptance. What? Right? You're not being accepted. Yes, that would cause depression or anxiety in anyone, as Xavier said. You can take that and put that in a straight person, and it's going to cause anxiety and depression.
Yeah.
And for those of you who follow our live sessions, when we had our Black Trans session, um, you know, our Black Trans, like we mentioned in that live session, they have a double whammy. They're Black and they're transgender. So right, talk about depression and anxiety. Talk about not being accepted. Talk about fear. Talk about anxiety of not knowing that when you walk out your door that morning, if you're going to come back, because you don't know who you're going to encounter in the street that's going to be offended because you're not normal, because you're not like them, and just decide to kill you, to put you down and punch you, and and these are things I think um, there are some of us who are lucky. I can speak for myself. I know Ray, and I know some of our viewers who have been lucky enough to have supporting family, and that we can walk out there and not give two F's about who and what. But that's not the common theme. That's not the norm. That's not what everyone feels. Most of the people in our community, especially our trans community, I think I think the gay community, I think the lesbian community have come a further way, even though we still fight our battles. I think we can walk today with a little bit more, with a little bit less fear, but our trans community still to this day walks in fear. To this day, our trans community still feels that they cannot walk the street safely. And that is a very big problem. And that causes anxiety and it causes depression, definitely.
All right, so we only have but a couple of minutes, and we want to go ahead and talk about the most important thing, right? Which we want to kind of like put out there is what do we do, right? How do we treat depression and anxiety? What do we do so, and how to seek help, right? When you know that you are struggling, that you are having negative thoughts about yourself or about life, or when you cannot get up from bed as you used to before, when you are doing so many different things, that well, you're no longer doing what you normally would do, right? So what happens then, right? How do we look for help? So the first thing is to acknowledge that you are not alone, right? And that this is what we want to make sure that our community out there knows, that you are not alone as an LGBT or as a queer member suffering from depression and anxiety, that it's more common than you think it is. And we want to make sure that you understand that, right? Because acknowledging is the first step into treating it, into looking for help, even if it's temporary. Because a lot of thank you for bringing that up, because
Yeah.
a person that suffers from depression and anxiety doesn't mean that their whole life has to be that way, right?
Mhm.
With treatment, you can treat that and reduce those symptoms and be okay. So acknowledging is one of the first steps that comes with that, right? And then the second one, I would love for Shacoya to talk about that, which is finding a professional that can assist you. So I'm just gonna throw this one out there to you, Shacoya, because I just gonna let you handle that one. Go ahead.
So, yes, find someone that you feel safe with, right? Just because someone is a therapist, just because someone is a helping professional, does not mean that you have to accept that help. Find the one that understands you and that you can speak to. Don't be afraid to say what it is that you need. If you don't feel safe with that clinician, don't be afraid to fire them and find someone else. I want to empower people to know that you do have choices. Find a clinician. I would just in me, Xavier, don't listen to this. A marriage and family therapist. I do. I mean, anyone that you feel comfortable with. If you don't feel comfortable, find someone else. There are people out there. They don't have to look like you. They don't have to um, be the same as you. But if you feel safe, you know that. And so go with that feeling. If you don't feel safe, walk away and find someone else. Don't stop.
Talk about the differences between a professional and a coach or anybody out there.
Right. So, licensed professionals are trained. We are trained. We go to school and we are trained to diagnose and treat mental
Mm-hmm.
health disorders. Um, Coaches, life coaches, and things of that nature, they're okay for certain things. They have their value in our community, definitely. Most of the time, I would say coaches are very good with immediate life issues, like financial struggles,
Right.
career
Mhm.
changes, helping you get over the hump of moving into a new place, and things of that nature. They're really good. They have a space within the therapeutic world, definitely. But licensed therapists, we go to school specifically for the treatment and for the diagnosis and treatment of mental health disorders. It is very important that you find, like Shakoya said, and I always say, and this is an analogy that I use, and bear with me, Shakoya, I'm a little crazy. Um, when you females out there, or for our males, or for our people, our queer people. When you go to the gynecologist, do you just walk up into the first door that you see and then just spread your legs open? Or for us as men, do we just walk into the first urologist office and then just drop our pants and bend over? No. We want to make sure that we feel safe. We want to make sure that we feel okay because we are showing to this doctor, to this gynecologist, to this urologist, parts of ourselves that are very intimate and private and that we would not show to just anyone. When you're
Mm-hmm.
talking about your feelings and your emotions is the exact same thing. You are showing parts of yourself that you will not show to anyone else. So why is that any different? You have to feel comfortable. Never feel uncomfortable with telling a therapist you and I, you are not for me.
Mm-hmm.
We want to hear that. We, as therapists, if we are ethical, if we are professionals, we want to hear that because we want to make sure that that engagement, that therapeutic relationship is for your improvement, is for your betterment, is for
Mm-hmm.
your health. And if we are not the right person, we can take it. We're big boys and
That's right.
girls. We can handle that. And we will be more than happy to look for someone who is a better match. Sometimes, us, even in therapy, we will point it out and say, look, I don't think I'm the person that can help you, but I have this colleague that I think will be
Mm-hmm.
a great match for you. So don't be afraid. You want to be able to feel comfortable to show parts of yourself to this individual that you will not show anyone else. And that is the most important part in therapy, that you can nude yourself in front of this individual emotionally and not feel judged and feel that this person is actually helping you with what your issue is.
So, thanks, Xavier. I just want to also point out that, part of Pride Support Services vision, right, when we started and founded this organization, was exactly to provide not only professional help, but also an environment that is equal and inclusive for our LGBT plus community. And this is why we're doing this, because we want to make sure that our community, our queer community as a whole, understands that this is a home for them, a safe place and a safe environment where they can be themselves and they can come and see one of us. But I want to also point out that this is whenever in therapy, it's really important that you understand that you have to be open to the process. And you have to be willing to work through the process with the therapist, and and be able and open to the recommendation of the therapist, right? Whether you feel that it is sometimes right, or if sometimes it may not be right, right? So be open to the process and be able to participate in the suggestions that the therapist is going to be giving you. I don't know if you have something to add to that, Shakoya.
I just wanted to say that make sure that just because if you're feeling depressed or have some anxiety, this does not mean that you're crazy. Can I just get that out of there?
Yeah.
It does not mean that. It does not mean that anything is wrong with you. It just means that you're feeling a little stuck. And that's what our job as therapists is, to help you move through that. And that's all. So don't be afraid. And our friends, I have one of my great friends here. She thinks she's my therapist. But also, your friends are not your therapist. So make sure you're finding a licensed professional as well because of that. Yes, your friends are good. We love them, but also we need someone to help move us through, right? And that's also important. Yeah.
And that's very important, when our friends hear us and listen to us. But one thing that our friends don't have most of the time is objectivity. And that is essential in the therapeutic process, because you need to be objective. Our friends, most of the time, they'll go with the emotion and they'll go through the emotion with us. And a therapist, even though they will walk through that emotion with you, they're going to be objective about it, and they're going to out what things are right, what things are wrong, what things can be improved. Therapy, people, for us, we as therapists go to therapy. And it's
Yes.
not because we're crazy.
Mhm.
We are encouraged to go to therapy because we deal with other people's problems on a daily basis.
On
And
top
the therapy,
of
right. And the therapeutic process is uncomfortable.
our.
There are going to be very uncomfortable moments. There are going to be moments where your therapist is going to push buttons. And there are going to be moments where your therapist is going to push you out of your comfort zone. That is the normal process. That is the normal process that we have to go through in order to effect change. Change is not comfortable for anyone. But if we want that change, we have to push those boundaries. So, again, but if you feel comfortable with that therapist, you'll see that that process goes by a lot more smoothly. And I also want to say, for all those of you out there who love that beautiful face as much as Ray and I do, I'm going to throw her under the bus. But Sequoia is going to possibly be joining PSSC, and she will be with us doing some things. Obviously, she needs money, so um, she's going to be doing her own thing, but she will also she has agreed to kind of help us out in this journey. So, me, Ray, Shakoya, we want to do this. This is what we love to do, and and this is what our passion, so we want to let you all know. Please, please, please reach out. Let us know if you need help. It doesn't have to be permanent. It could be just a transitional thing. If you feel as though you cannot handle the situation that you're going to, reach out, you know? So,
And so last couple of things is and we wanted just to mention to everybody is that our support groups will start back up again mid-August. We will be announcing it to everybody out there. We are going to be having support groups that are going to come. They're going to be smaller than usual, so they're going to be a limit. So it's important that you sign up for them fast because it's mostly going to be probably about 5 or 6 people at most because of the regulations of COVID and the space. However, we're going to start doing that plus also therapy in our own space that's going to be announced pretty soon. Thanks to Hearts Beat as One Foundation, Hearts Beat as One, HB1, Joe, and all the crew members from HB1. Yes. Thank you guys so much for taking us under your wing and helping us in the process of growing. And so, so we will have that available to you. But I want to say one more last thing before we go, and it is that, and I this is what I always tell my clients, especially when you are suffering from depression and anxiety, that once you are better, a great way of combating depression and anxiety is to get active.
Mm.
Is to volunteer. It's to become a volunteer and help others, right? So it's what I say religiously, or in, it's given by grace what you receive by grace, right? You receive help and you put it into action. And a lot of times when you do that, it's another level of growth for you, another level of where depression is to the side, no longer hurting you because now you're not only dealing with that yourself, but you're also helping others to come out of that. So we will have opportunities for volunteering, soon. And if you want to volunteer, you let us know as well. Shakoya, any closing words or remarks before we go?
Thank you guys for inviting me. I enjoy this, and I can't wait to see what else that you guys provide for us. What you guys are doing is huge, and it's also not helping the LGBTQ community. It's also helping us allies getting to know better, and just to so that we can know where that we can help. So thank you for that, and you guys take care. This is a hard time right now with COVID and all of this other stuff that's going on in the news. Make sure that you're not watching the news as much as you need to preserve that, so you're not getting depressed and getting down. So just take time, know that everything this is not normal times, so we should not feel like we're supposed to be normal, whatever that means. Just give yourself grace. That's all I say.
On self-care, right? Self-care, but you got to do it wisely and carefully, right? You want to make sure that you don't put yourself at risk or put others at risk as well. So, continue to follow the North Carolina laws as far as, you're wearing your mask in public areas, that you stay 6 feet away from people when you're out there, that you're also having small gatherings. I think it's less than 10. Is it still less than 10?
Yeah.
So, less than 10 people. So please be careful. And let's continue together to battle this COVID-19. One more last thing, I promise I'll let you go. Number one is that obviously we want to thank our HB1 again, Hearts Beat as One Foundation, for helping us throughout this process and being, our fiscal sponsors. But we also want to thank our other sponsor that has been actually doing all of these wonderful things and putting us out there into the Facebook Live and doing our marketing. Our website, by the way, is up already. So www.pridesupportservices.org and obviously Facebook. But we want to thank YouTube. Oh, and all of our videos now are on YouTube as well. So you can, yeah. So we want to thank Fernando Mayoral for, the president of yourpartyonline.com. Yourpartyonline.com is one of our sponsors for PSSC and is the one that has been doing this great, awesome job for us in our marketing. So if you have a business and you're struggling or anything else, please reach out to us or go to yourpartyonline.com and talk to Fernando. We truly, truly recommend him. And he is also part of the LGBTQ plus community as well. So thank you guys. We love you. Thank you for being with us. If you need us, we're always here.
Shacoya, stay 5 seconds after. Guys, as usual, we love you. We are nothing without you. We will see you next week. And we will be live from our CEO's wedding, who is getting married next week. So, bye until next week. Love you guys.
Bye bye.
Bye bye.